Hey, what's up, guys? It's Jacob here from Unlittle Me, and I just want to talk to you today about why you are not having a heart attack. Okay, before I get started, I really want to make it clear to you guys that if you're experiencing anything unusual or out of the norm in your body, and you are concerned about it, if you're actually righteously concerned about it, then do definitely get it checked out, because I'm not a medically trained professional. If you feel like there's something wrong, get checked out first. If it's an anxiety diagnosis, then I think this video is really going to help you, because I don't know. These are some things that I've learned that really helped me. Okay, so first things first, right? When we experience a palpitation, we feel like it's a heart attack. Essentially, we feel like that something sinister is going wrong, and that we're going to, quote unquote, die, I guess, or that we have some kind of horrible condition that's going to limit what we can potentially do with ourselves. Now, I want you to actually think about, how when the last time you got palpitations, or even if you're experiencing palpitations right now, what is your emotional outlook on it? Okay, how do you emotionally feel about the sensations? Okay, do you feel frustrated? Do you feel anxious? Do you feel a little bit bothered about it? Okay, ask yourself, what is your emotional state right now? How do you see yourself emotionally right now? Okay, and look, I'm willing to bet that's not exactly 10 out of 10, is it? However, the reason why you are actually worried about these heart palpitations is because they feel unusual. They feel like, it's something that is just there. Okay, something that is just there, and it's running in the background, and you don't know why it's happening. Okay, and I think it is the best treatment for you here is education on what's happening. Okay, now I'm no cardiologist or anything like that, but I have looked a lot into what causes heart palpitations, and I know this might be beneficial to you. So first things first, number one, in most cases, majority of cases, palpitations are not dangerous. Okay, and the reason for that is because palpitations are a result of an electrical mismatch, or an electrical problem in the heart. Not exactly a problem though. It's something. Palpitations happen in most people. Okay, but with palpitations, okay, there is basically the pacemaker in the heart, and the pacemaker is essentially an electrical impulse. The pacemaker is an electrical impulse that signals the heart to contract. Okay, and when the heart contracts, it pushes the blood out. Obviously, now when you're not experiencing palpitations, the heart is pumping to a rhythm that is quite consistent. Okay, to the electrical impulse, aka from the pacemaker. Now, when the pacemaker kind of actually doesn't quite tell the heart to beat in a consistent manner, what happens is, if, say, the electrical impulse doesn't fire between two heartbeats, and it skips a beat, okay, when your heart skips a beat, you're going to feel that next beat with a lot more force, okay? And the reason for that is because when your heart is pumping, it's filling up with blood, and then it contracts. It fills up with blood, it contracts, okay? And when your heart misses a beat, it's still filling up with blood. And all this blood it fills up, it probably fills up with a lot more blood than normal. And then what happens is the heart beats and contracts with a lot more blood coming out, and this is where you feel that thud in your chest, okay? And this is something that happens very, very commonly in many, many, many different people, okay? If you are going to have a heart attack, okay, the reason why you would have a heart attack is because heart attacks are due to an issue in the plumbing of the heart. So essentially, heart attacks are a plumbing issue in the heart. Essentially, whereby if you have plaque buildup, or if you have a buildup, if you have coronary artery disease, or if you essentially have a if you have something blocking the blood from being able to get to the heart, that essentially is what can determine a heart attack, okay? Second thing is that if you have a history of just blacking out, okay, and I don't mean just like fainting or just, when you, I'm not just talking about fainting from, getting nervous or anything like that. I mean pure, just unexpected, uncontrolled blackouts where you just drop to the floor like that without reason, okay? If you have a history of blackouts, or also if your family has a history, if you have a family history of actually of people dying at a young age for sudden death from heart attacks, or cardiac arrest, or if you have a family history of people with heart conditions, definitely get yourself checked out. But I'm saying if you have a history of heart problems in the family, or if you yourself individually have a history with blacking out, that would very much warrant a diagnosis from a cardiologist. You definitely want to get a referral or go see a doctor. Okay, now assuming that this is not the case, okay, then essentially what you're simply dealing with is just an electrical impulse in your heart that is just simply misfiring, okay? This is an issue to do with the pacemaker in the heart. In which case, for the majority of the population, from what I've researched into, from the cardiologists I've actually read about on the internet and seen on the internet, things to do with palpitations and where the pacemaker causes the heart to skip a beat, is very normal and actually happens in most people. Okay, and let's think about it this way as well. The heart is simply just an organ, right? And what is the heart's function to do? Well, obviously, it's to keep you alive. But much in the same way as your liver keeps you alive, much in the same way as your brain keeps you alive, much in the same way your lungs keep you alive, all of these different organs in your body serve the function to keep you alive. And it's not as if, everything in your body is going to run absolutely consistently and perfectly all the time, okay? Your body is a very dynamic system, and there are a lot of times where, you're going to just feel a strange sensation in your body. And given that your heart is a normal, dynamic organ that just is there, it's necessarily just because you feel heart palpitations doesn't necessarily mean that you're going to die, okay? I mean, second to that, say people who are alcoholics, who drink all the time, who, drink like 10 beers a day or 10 beers a night, they're potentially damaging their liver, but they can't feel their liver. And so if you are one of these people, that is something that, I would get, tested by a doctor about, because essentially, just because you don't feel your liver doesn't mean that there's nothing wrong with it. I'm not trying to actually do some fear mongering here or anything like that. I'm just saying that if you believe your other organs to be fine, such as your lungs, your pancreas, kidneys, whatever that may be, then why not assume that your heart is completely normal as well? Okay, it's completely fine as well. As I said, I'll say it again, heart attacks are due to an issue to do with the pacemaker, the electrical impulse in the heart, and it doesn't mean your heart's going to stop. It just means that your heart is going to thud harder if it skips a beat, and it's going to thud harder if, due to certain under certain circumstances, or demands, such as when you stand up quickly from sitting down for too long, you get that dizziness, a little bit of that lightheadedness. That's your body adjusting to a certain circumstance, and your body, and your heart, thuds and accelerates a bit to get the blood to the brain, so that gravity isn't pulling it all the way down. Your body's doing this normally. It's a normal function of the body. Lastly, I'll end with this, okay? And this is a big one. If you really think you're having a heart attack, then you would have been experiencing crushing pain in your chest, okay? On accounts from people who have experienced heart attacks in the past, they describe the feeling as if an elephant is sitting on their chest, okay? And you are meant to feel a very, very horrible, crushing sensation in your chest, and it's something that will knock the breath out of you. It is something that will cause you to fall to the ground because it hurts so much. And with anxiety, you have this kind of if you are actually just merely thinking about the pain you're feeling, that doesn't necessarily mean you're having a heart attack necessarily, but if you're just experiencing random, just kind of pain in your chest, it could be another variety of causes, such as, pain in the pectoral muscles of your chest, or it could be pain in the sternum, or in the rib cage if you've been sleeping a certain way, or if your posture has been a certain way all day. So necessarily chest pain doesn't always indicate a heart attack, and the chest pain you feel is something that is fleeting. Sometimes it can linger and it'll go away, and that just really means that's just simply I wouldn't say it's just anxiety. I mean, sure, you could call it because of your anxiety, but obviously it is a physical thing that you're feeling, and you may not necessarily feel anxious in the moment you're feeling this, much the same way that I do myself. But what I'm just getting at is that essentially, but what I'm getting at is that pain in the chest area is usually something that is fleeting if you can still think about it and worry about it. Necessarily, I don't really think there's anything potentially wrong with your heart. But as I said in this video, everything that I've said is just stuff that I've read and watched online, okay? And necessarily, I'm not a medical professional, so I urge you again, if you are experiencing something completely strange or different in your chest, do get checked out. But I hope otherwise this video was of some use and value to you. So if you have any further questions, do send me a question on my blog, which is anxietystation.tumblr.com. And if you enjoyed this video, do hit the like button, and I'll be making some more videos to come. So anyways, enjoy it wherever you are in the world, guys. Peace out. Catch you around.